Before you start any treatments like radiation or chemotherapy, it's really important. Welcome to the Cancer Nurse. I am Jamie, your friendly neighborhood oncology nurse. And today's episode is important things you need to tell your doctor about. As a reminder, nothing we're going to talk about should replace a conversation with your oncology team, nor is it meant to be medical advice. Things you should talk to your doctor about or they should know about before you start chemotherapy treatment. For those of us who are of childbearing age and who have not had kids or want to have more kids, make sure your physician knows if you are expecting or if you become pregnant, if you are currently breastfeeding. Please also make sure that you have a conversation with your physician about preserving your fertility if you are going to undergo any kind of cancer treatment and still would like to try to have children in the future. One hiccup that can come into play is that maybe we don't have time to harvest eggs or sperm to preserve that fertility because the situation is a little more dire and we need to get that treatment started right away. And in that situation, I sincerely apologize. There's not a whole lot of options. If there is enough time and there are options, a conversation to have with your doctor is definitely, how do I preserve my fertility? Whether you are male, female, non-binary, but interested in being a parent one day, wherever you fall on that spectrum, that is a conversation your oncologist is going to be able to answer, and able to answer the question in a conversation they can have with you. Something else that is important to talk to your oncologist about is, what supplements do you take? Do you regularly take vitamins? Do you take probiotics? Do you take some kind of mushroom supplement? Whatever that may be, have a conversation, because we don't know what you're taking if you don't tell us, if there's not a prescription for it. And what you're taking could interact or interfere with either chemotherapy or your radiation. An example: high doses of antioxidants like vitamin C and lots of other antioxidants out there can actually protect all of our cells in our body, which is a great idea. It's great on a normal situation, everyday situation. Protecting our cells and keeping them healthy is super important. When you are undergoing cancer treatment, especially radiation, sometimes those high doses of antioxidants also protect the cancer cells, because the antioxidant, it can't differentiate which is the good cell to protect and which is the bad cell to protect. So if we are taking super high doses of antioxidants, you run the risk of protecting the cancer cells and rendering your radiation treatment much less effective than if you were not taking those antioxidants. Again, check with your medical professional to see what you are taking and how it may interfere. There are some medications that make chemotherapy work even more, so it increases the amount of side effects you have with your chemotherapy. And there are some medications that may render your chemotherapy less effective. So that's really important, whether they're over the counter, a supplement from your naturopath, or something that's been prescribed by your primary care or a different physician, that you are talking to your oncology team about any of those medications or supplements and making sure that they're safe and appropriate for you to be taking while you're receiving treatment. So the last thing we want to do is render your treatment ineffective, but make you deal with all the side effects and not fun aspects of that treatment. If you want to keep your hair, there's lots of things you can try, but definitely check in with your physician about whether it's safer for you to apply directly to the scalp, like minoxidil is the generic name for a lot of those hair growth serums, or if it's safer for you to take a pill in order to do that. Another thing to think about, if you have estrogen receptor positive cancer, generally that's breast cancer. If it's estrogen receptor positive, your doctor is going to want to suppress all of your estrogen. However, there may be a topical or vaginal suppository of estrogen, a form of estrogen that you can take to help with vaginal dryness and irritation. So definitely talk to your physician about what topical things are okay or safe, or is there an oral or by mouth PO version of that same medication that I could take to help prevent hair loss or help manage my hormone imbalance. Alcohol and THC consumption are big hitters in the oncology world, and Whether or not it is safe for you to consume alcohol or to consume THC is a conversation you have to have with your medical provider. There are benefits to THC and there are drawbacks to THC. There is a momentary personal satisfaction from alcohol, but there are also health consequences from drinking alcohol. So it's not a decision that you need to make on your own or that you should make on your own. It is a decision you should definitely include your medical provider in and get their feedback. And ultimately, it is your decision. So, before you start any treatments like radiation or chemotherapy, it's really important to talk to your provider about any upcoming travel plans or life events that you have going on. So, say your kiddo is getting married or you have a cruise you're going to go on. Depending on your diagnosis and the stage of your cancer, it might be beneficial for you to be at that wedding or to go on that cruise and take that vacation. It also might be more beneficial for you to try to plan your treatment around that wedding or life event or to try to reschedule that vacation. Um, it is something to definitely talk to your provider about. I know in the chemotherapy world, you're not doing treatment every single day, not even every single week. So you might be able to arrange your treatment dates in around an event that you want to be a part of or participate in. In the radiation therapy world, usually you're receiving treatment Monday through Friday, like every day. So if you have a vacation or an event coming up, you might be able to start treatment early enough that you are finished by the time that event is coming up, or start treatment a little bit later so that you are able to attend that event or that go on that vacation. But again, a decision that needs to be discussed with your medical provider about what is best for you as the individual. Other things your medical team should be aware of are if you've had treatment before, if you had childhood cancer, or if you've had radiation before for maybe a benign treatment. Sometimes they radiate things like Dupuytren's, which is a contracture in your hand or foot. Sometimes they'll do radiation for osteoarthritis or post-surgical radiation to prevent arthritis on like a total knee replacement. If you have experienced any kind of radiation, your radiation oncologist needs to know about that because they're going to need to reach out to the provider that provided it and get details about how much radiation you received and to what body parts. If you've had cancer before, there are some chemotherapies that have a lifetime limit on their dose. And so your medical oncologist needs to know if you've had chemotherapy before, because if that chemotherapy is something that has a lifetime limit on the dosing, meaning you can only have so much and it's not safe to have any more, then they need to know, they need to reach out to that previous provider and find out what chemotherapies you received and how much of them you received, which will help direct your treatment if you need to get that same kind of chemotherapy. I think it's important to know this. Cancer is often talked about in survival rate. So there's a 5-year survival rate. And what type of treatment you receive and how or the order in which you receive those treatments can impact the 5-year survival rate. So it's always good to ask questions about what is that 5-year survival rate for my diagnosis? What can I do to increase that 5-year survival rate? Or if I do X, Y, or Z, does that decrease my 5-year survival rate? The other thing to keep in mind is that rate is an average. So there are always outliers of that. And we, as your medical team, I say we because I still am working in this field, we don't know where you're going to fall. We don't know if you're going to be a part of that average or if you're going to be an outlier in that average. So there's no way for us to tell you exactly. We can only give you the numbers from the research and data that is currently available to us. But it's a good information to have and it's a good question to ask. Is your hair going to fall out? I don't know. It depends on what chemotherapy you're getting. Some chemotherapies make your hair fall out. Some of them don't make your hair fall out. Radiation is only going to make the hair fall out on the area that's being irradiated. So if you have breast cancer, whether you are male or female, because men can also get breast cancer, if you have hair on your armpit and we're radiating these lymph nodes over here, that hair might fall out. If you're a male with breast cancer and have a hairy chest and we're radiating this portion, that hair might fall out. If we're radiating any portion of your scalp or brain, the hair where we're radiating is very likely going to fall out. If we are radiating head or neck cancer, like tonsillar, base of tongue, laryngeal cancer, and you are a man with facial hair, you can pretty much guarantee that this hair is going to fall out, but not the hair on your head. So just depends on where the radiation is occurring and how hairy that body part is, or the chemotherapy you're getting and how much of it you're getting. Some people have some hair loss, some people have a lot of hair loss, and some people have none. Just lots of factors that fit in there. And just keep in mind that because you know someone that had cancer and had treatment and lost their hair does not automatically mean that you are going to lose your hair during your cancer treatment. And vice versa. If you have a friend or family member that went through cancer treatment and didn't lose their hair, it doesn't mean that you are going to get to keep your hair. It's all very dependent on the treatment regimen and the area of treatment. Thank you for watching. Don't forget to like and subscribe. And if you are interested in joining our community, the Patreon link is below. Toodles.